Well, my name is Bill Lyle. I practice obstetrics and gynecology in Pensacola, Florida. I'm board certified in obstetrics and gynecology. And we're here in Fort Lauderdale, Florida at St. Thomas Aquinas Catholic High School. And we're going to be doing a presentation I call God's Miracle of Life. I came to the realization that the abortions that are being performed here in the United States are primarily being performed by my peers, by other people who've spent their lives, learning about obstetrics and gynecology with the goal of trying to have healthy moms and healthy babies, and realize that there has to be something that we can do to educate people, to let them know about the amazing development of the babies on the inside. We're also going to talk about abortion. We're going to talk about the numbers of abortions that are performed, and we're also going to talk about the different techniques that are going to be performed and how abortions are done. And I just appreciate the opportunity to let y'all know the truth, because we really realize that if people really understand the truth, we wouldn't have the 1.3 million abortions performed in this country every year. What we're going to be talking about now is how these procedures are actually performed. We've seen the babies on the inside, we've seen how we can do surgeries on these babies to fix them. We know how many times abortions are done in our county and state and in the country. Now we're going to go through the first and second and third trimester abortions and give you good ideas on what's actually going on. When you hear an abortion is done or you hear a partial birth abortion, I want you guys to have a real good idea in your mind. It's like, oh, that's what that was. Okay, now I understand. First trimester abortion. The mental image, try to picture my daughter, there on the inside in the ultrasound when she was kind of jumping and sliding, jumping and sliding. That would be at the end of the first trimester. This is a speculum, okay? First thing the doctor would do is he'd have the mom up where this chair would be, okay? And the surgeon would be sitting here, in a chair across from her, and her legs would be up this way. The surgeon would take the speculum, which is going to go into the mom's vagina, to give them a view of the cervix. The cervix is the lowest part of the womb or the uterus. And when you hear when somebody's in labor and they say her cervix is 5 centimeters, her cervix is 8 centimeters, that's what's opening up. The cervix is what's opening up before the mom can actually have the baby. But the job of the cervix is to keep the baby inside until she gets to her due date, until she gets to be term. So what the surgeon has to do and the abortionist has to do is to actually go in and forcibly open up the cervix in order to get the baby out. Because that's his only goal. His goal is to kill the baby and get the baby outside of the uterus. So the first thing is the speculum is placed in the vagina, all right, and it's opened up. And when it's opened up, the doctor can then see inside and can see the cervix, the lowest part of the womb. The doctor would then take something like this, and this is called a single-tooth tenaculum. Tenaculum is then sometimes placed on the inside and it grabs the cervix. You can see how that would grab and would not let go. That's a tenaculum. So that way he has a hold of the cervix and he has a hold of the womb, and now he can start to open up the cervix. Okay? So I'm going to set this down. Well, the cervix is closed. I mean, it's closed tight like my fist right there. So they have to open up the cervix in order to get up to where the baby is. So they do that by forcing small pieces of metal called a dilator. This is a small one. This is called a dilator. And the tip of this is placed into the cervix, and then it opens it up a little bit. Well, these instruments can go up and get a lot bigger depending on the size of the baby, so that you can forcibly open up the cervix in order to get the baby to come on down. So with a first trimester abortion, they'll dilate the cervix, and then after they've opened up the cervix, and essentially the door to get up into the womb, they'll take an instrument like this. This is called a suction curette. A suction curette is attached to a hose, a little tube that goes to a suction machine, which has, a large vacuum pump in there to suck out whatever is up on the inside. During the first trimester, this machine is so strong that it can actually suck out the baby with as developed as you saw my daughter jumping up on the inside. I mean, her muscles are there, her bones are there, everything is already there, and it can suck it through this tube. So this tube this curette is placed up inside the womb, the suction machine is turned on, and the baby with all of its arms and legs and heartbeat is then brought out in pieces, through that suction tube and ends up over in the suction machine. All right. So years ago, when they would show babies after they'd had an abortion, they said, look, it's just a blob of tissue. This wasn't a baby. Yeah, of course it doesn't look like a baby because you've just torn it apart. It's kind of like, looking at a lump of hamburger and say, there's no way that was ever a cow, because it just doesn't look like it. When you put a baby through a machine that's that strong, it's not going to look like a baby anymore. But that's how the vast majority of abortions are performed with the suction machine, okay, and brought out through that small little tube. Now what we're going to do is we're going to talk about the second trimester abortion. Remember the baby that was getting the surgery? All right, remember they were doing the surgery on the baby's back? Well, when the baby is that far along, there's no way you can bring the baby down through a tube like this. You'd even have trouble bringing the baby down through a tube that big, okay? So since you can't bring it out through a tube, then you have to use something like this. And this is a forceps that has teeth here on the inside. The teeth are kind of like shark's teeth. They all angle back. So if I put this on my finger and I pull backwards, it just grabs stronger into my finger because they don't want to lose a grip on what's up there on the inside. So we're not going to show you any baby parts, we're not going to show you any blood, but you're going to know exactly what's going on. The baby's there up on the inside, just like we saw them operating on that baby and fixing the defect in the baby's spine. Baby's up in the womb. They use an ultrasound machine. They use the speculum, they dilate the cervix as large as they can get it, and then they'll use the ultrasound machine and take this instrument and they'll guide this up inside where the baby is, up in the womb. They'll open it up, and while watching the video on the ultrasound, they might grab an arm, and since they can't pull the whole baby down, they'll grab an arm and then they'll rip the arm off while the baby's still alive, and they'll take that arm and they set the arm aside. Then they'll reach back up and they'll grab an arm, maybe a leg, but they just keep reaching and grabbing until they've brought all the baby parts down. The abdomen, the chest, the lungs, the ribs. The last thing that's usually up inside is usually the baby's head, the baby's skull, because that's usually the hardest thing. And it's large enough that a lot of times they have difficulty just bringing it down because it's, a round circle. It's just a little bit too big. So they'll actually grab it with this instrument. They'll be able to see it on the ultrasound. They'll grab it and then actually crush it to make it small enough so they can bring it on down. So when you picture, the babies that were getting surgery done, and you see how well developed they were. I mean, to dismember a baby like this is what a second trimester abortion is, okay? And sometimes people will say, well, do the babies feel pain? Absolutely. When we're doing a test called an amniocentesis, where we're putting a needle inside around the fluid around the baby to get some fluid out to do special tests, sometimes when the babies are moving around, they'll bump up against that needle. And as soon as the babies bump up against that needle, their heartbeat goes up, they'll jump back, they'll say, I don't know what's going on over there, but I don't want to be anywhere near that side of the womb, okay? So they do feel pain. If they can react to just a tiny needle, you can imagine how these babies will react when they're having an arm or a leg just taken off. But that's how a second trimester abortion is performed. The next thing we're going to talk about is what's called a partial birth abortion. If we can't get the nation and our legislature to understand what's really going on here, we're never going to have any kind of an impact. Partial birth abortion can be performed at any gestational age, okay? We talked about Roe versus Wade and all the things that came into that. There are so many things that when you think, you can do this procedure if mom's health is in jeopardy, you think, well, I guess if we don't do this, mom dies, that means her health. Health is defined as physical, emotional, psychological, age, familial, so just about anything, too young, too old, anxious, depressed, any of these things can be considered health and have these procedures to be performed. But with a partial birth abortion, the baby is there up on the inside and the baby is alive, all right? They will then use an instrument, they dilate the cervix, sometimes it takes a couple of days to open up the cervix enough in order to deliver the baby, and this can be done at any gestational age. But what's done is then the baby's foot is grabbed up from the inside and it's brought back down, all right? So we're essentially delivering this baby breech, all right? And when the first foot is brought down, the baby is still alive. They then reach up and they'll deliver the second foot and the second leg. And now they have a good grip on the baby, and baby's alive and baby's moving around. Then they'll put a little bit of traction on, they'll start to bring the baby down a little bit more. And as they're bringing the baby down more, the arms start to come into view. And they'll reach up with one finger They'll grab the right arm, they'll sweep it down, and they'll deliver the right arm. Then they'll rotate the baby around, and they'll deliver the left arm. Now at this point, 90% of the baby is on the outside. You know, the baby has already completely left the womb and is beyond the cervix, and it's just the baby's head that's sitting there still in the vagina. Legally, the baby is not born yet. All right, the baby hasn't taken its first breath. The baby's alive, moving, doing its thing while it's being held in the doctor's hand. And I use the term doctor really loosely, but the baby's being held right there. But what they need to do now is they need to, do the abortion procedure. They need to kill the baby. And the way they do that, it's one of the more common ways, is they'll use a pair of scissors like this. Now, you remember from your biology class, remember the foramen magnum, that hole in the base of the skull where your spinal cord comes down from the brain into the back, into the spine? This scissor is then placed at the base of the baby's neck, at the base of the skull, and is forced up into the baby's skull, into the baby's brain cavity. And then the scissor, is opened up just like that to expose that area. If this doesn't kill the baby just by doing that, then the thing they can do is they can then take a suction curette, place it up into the hole they just made, up into the baby's brain, and then turn the suction machine on. Just like it crushes a steel can, you can imagine what it does to the baby's brain up there on the inside. Once they've done that and they've killed the baby, which now of course stops moving, then they'll deliver the rest of the baby, dead. But that's when you hear partial birth abortion. There's no way that part of the procedure, yes, there are some reasons where we need to deliver babies early. When moms are sick, and the only way we're going to get mom better is by delivering the babies early. But to deliver the legs, the belly, the chest, and both arms of this baby, and then kill the baby at that point, how does killing the baby at that last second protect the mom at all? It doesn't. It's just a way of being able to justify in somebody's head killing babies at any gestational age, whether it's the first trimester, the second trimester, or the third trimester. But that's what a partial birth abortion is. When it comes up in the news and it comes up, in the legislature, that's what's really going on. Just picture that. I mean, babies that would do just fine. We have babies that do well at 23, 24, 25 weeks at our intensive care nursery, and we have great survivals. I mean, these are babies that are even further along than that all they need is just let the head come out, clamp the cord, cut the cord, let the baby go to the nursery, okay? But those are first, second, and third trimester abortions. If you look over on the far right side, you can see the cap of that steel can, and there's a small little tube coming out. Well, that's that little suction curette that we were demonstrating with. Well, I've taken that suction curette and I've attached it to the hose that goes to the suction machine, and even though I can't crush that can, I can't even stand on it and crush it, when you just turn on the suction machine with just the suction force alone, that's what it does to the can. So you get an idea, it's like, well, if we can do that to a steel can, you can just imagine what that's doing for the first trimester baby there on the inside, and also what it's doing for the baby's brain there on the partial birth abortion in the third trimester abortion.